Thank you, Rohan. Thank you, Dr. Varmudora, Dr. Himanshu, Dr. Ragini, and all Pooja, all everybody here. And thank you for keeping my talk after Dr. Bhatt talk, because now everybody will take it seriously. So, can you hear me, Rohan?
Yes, sir.
So they are zero endophthalmitis means does not mean zero. Means the importance is that the chances of endophthalmitis are minimized in your OT in your area. So this is march to zero endophthalmitis, and this is achievable just following this, keeping in mind 5 possible factors alone or in combination: patient personal hygiene, contaminated surgical supplies, faulty sterilization procedures. This is very common in endophthalmitis cases. Inadvertent touch and environment. What are the preoperative risk factors that we have to take care? Blepharitis, conjunctivitis, the obstruction, recent immunosuppressive treatment. So we should have thorough preoperative clinical assessment of the patient. What investigation? What I am talking, this is under the AIS guidelines. If you mention this in the court of law, you are safe, because AIS are a parent body, and whatever AIS says, everybody has to follow, and judge has to accept it. Blood sugar less than fasting 120 and random less than 200, you are safe. You should not operate. Now there is no risk of operating at 220, but we should avoid it, because if something goes wrong, we cannot code in the code that is it was allowed. Syringing should not be done on the same day, it has to be done. What preoperative medication instruction to be the patient? Broad spectrum antibiotics 6 times a day before surgery and on date of surgery. Patient should come with face wash, hair with soap. Male should come with shave. They should wear the clean clothes. What instruction to the staff? If biometry has to be done on the same day, use immersion method to avoid contamination. If there are more than 5-6 cases in the OT, diabetic patient should be given preference. Preoperative is very important. Iodine 5% 2 times topically 5 minutes before surgery. It is good even if you do not have used antibiotic 1 day before. So iodine 5% 2 times is very important before surgery. We should clear all the brow region, lid margin with 10% iodine solution, and should change our clothes. Everything should be changed. That is street clothes. This is scrubbing very important. This chart should be hanged over the scrub area. Then they have to take this scrubbing for at least 5 minutes. If this is hanging over the scrub area, they will take care of it. Chlorhexidine antiseptic soap or povidone iodine liquid scrub should be done properly for 5 minutes. If you check, you go in the OT tomorrow, you see you will to take care. Dipping is very important to prevent the infection, because it prevents the eyelashes coming in the opening area. So it should be done properly. This is very important thing. Monitoring surgical supplies. Check expiry date, because you are not. There was a case in Delhi recently where expired lens was implanted in the patient eye. Patient attendant has seen this expiry date. Patient was well. Even then, doctor was penalized. Check clarity of irrigating solution for any suspected particle. We have seen in all the camps and all the OPD everywhere, the clarity of the solution is defective, means irrigating solution, digalactate or BSS, or any other, or we are using methyl cellulose. We should always check the clarity before using it, because most culprit lies in this area. Ideal is one irrigating motor for one patient. Lot of discussion in India, but we request them to make a motor available so that we can use one irrigating motor for one patient. Phaco sleeve and tip should be changed after. Antibiotic in the relief is not very helpful. It has been already discussed. Subconjunctive antibiotic given at the conclusion of surgery has been found to reduce risk. Intracameral injection we were not using previously, but Dr. Haripriya has come out with a long study of more than 18,000 patients, and there she has very clearly indicated that it is very helpful. So we have started using intracameral injection in every patient now. Watertight corneal incision is very important. If there is a complication like PCR, we should manage it effectively. We should not leave the vitreous in the antechamber. Isolation during surgery is very important. We should keep an eye on temperature, 134 degrees centigrade. And if you have no high-speed autoclave, then you should have alternate this adequate number of surgical sets with you. Autoclaving is very staff. I know so many staff, if you go and ask the staff, they are not knowing actually what they have to do. This is not the temperature only that it is achieved 134. It is a time also. You should stay there for at least 30 to 40 minutes. Overfilling in the drum should be avoided so that the air can rotate all around the drum. Monitoring is very important. Temperature, pressure, cycle duration. A person should be there who should maintain a register. They should issue I have a register where attendant writing at the time started, what time whistle started, and at what time the article was closed. Although my autoclave is fully automatic, but even then we note down. So the autoclave should also be clean instrument, but we should clean the autoclave also for after every month for 25 to 30 cycles. And for this, the biological indicators are available. Chemical extraction is not recommended nowadays. Physical indicators are strips that we put outside the drum, but this tell only that this much temperature has reached, but does not clearly indicate that temperature has maintained there for 30 minutes. For this, we have chemical indicator. If temperature has maintained for 30 minutes or 40 minutes, whatever is your autoclave says, it will show the vapor line or whatever indicator you are using pass. Only then you can use the instrument surgery, otherwise you should postpone the surgery. Biological indicator for autoclave, we have already discussed. Cleaning OT, remove the dust with a clean wet cloth. Do not do is not allowed in the OT. It will infect material all around and on the equipment. OT floor, trolley, everything should be cleared by bacillus solution or other alcohol-based solutions. Keep floor clean during the surgery. Do not discard soil linen and chrome on the operating theatre. Keep the floor dry when OT can use dehumidifier. Fumigation of OT nowadays is not recommended because it is cancerous. Scrub you should clean the scrub sink almost daily, and AC filters should be checking care. Microscope, head, phacocortic instrument, they all should be clean. These are the cleaning procedures we are writing. Important, Rohan has insisted me on speaking on model OT also, so I'm just giving brief introduction. Zoning is very important. What is the zoning? There are 4 zones: protective zone, clean zone, sterile zone, and disposable zone. Whenever any newcomer is for youth, they are planning the OT, they should maintain these 4 zones. Protective zone is reception waiting area, clean zone is the pre-operating room, recovery room, sterile zone the operating room, scrub room, and disposal zone is where we dispose the corridor, where we dispose of our used material. OT should be away from the public movement, and following features should have. Model OT is recommended but not mandatory and NABH. OT should have seamless walls, non-porous floor without corners, with antiseptic, antifungal paint. Doors should be always kept closed. Restrict the number of persons to minimize during surgery. Culture and sensitivity very important. We should take sample from floor, wall, OT table, AC, phaco machine, and should keep recording the data. But we'll agree that we should maintain an autoclave register. We should every month we should get the sample done, and should every OT should have air handling unit that should be separate for that OT, and no split of window AC should be allowed nowadays. Air exchange per hour, OT is maintained at 20 cycles per hour, where fresh air component should be minimum 4. This is air velocity, air filtration. HEPA filter is very important. That can save 99.9% down to 0.3 micron any bacteria and virus. Temperature, humidity 20 to 30 degrees centigrade, humidity 40 to 60%. And fans are not used in the OT. Positive pressure is very important. We should have got I have a meter outside my OT, which tell me outside pressure is minimum 4 to 5 Pascal more than the interior pressure, so that the outside air will not enter the OT whenever the door is open. So there outside the OT. Maintenance is very important. We should have ventilation system every year from third party that will also save you in the court of law. Who will maintain temperature, air particle count, air exchange. I have a report of 12 pages with me, and that is to be done every year. Water tank, nobody take care of the water tank. Water is important reservoir of microorganisms. We should have separate water tank for OT, and we should clean it once in a month. Normally what happens, they are a water tank for all the OT operation theater, all the hospital, common water tank, and nobody take care of it. We should have separate water tank and we should clean it once in a month. We should have daily checklist for IoT like this. Who checked the periodic check? Who checked the autoclave register? Who filled the drum? This all things should be noted and signed by a OT assistant. This is important. Important in the sense that person who is responsible for the OT will be think twice before skipping anything, because you know doctor is going to check it and sign it. It should be signed by him. Any document is signed by attendant. He will always be conscious. Who did preparation before I have a surgeon? So all these things should be documented. Who did cleaning, mopping before leaving in the OT? Who cleaned equipment? Everything should be noted and signed by a OT assistant and signed by the doctor. This is a weekly checklist. Who checked the medicine check, expiry date? Who checked the OT list? Who submitted autoclave report? Cleaning done on Saturday or not? This should be weekly list. Which instrument who clean? What was cleaned autoclave? Who done it? So this should be art in the OT register. Outside the OT should be hanged, and the OT in charge should take care of it. Expiry date of medicine should always be checked every week. This is a monthly checklist. Who took the saw sample culture from the wall? OT is AC cleaned or not? Did in charge check the washing of OT on last Saturday? Iris stock report completed or not? So this thing should be monthly. So I say, who cleaned the drum? So this thing should be signed by the OT attendant, OT charge, and this should be also signed by the doctor. This will make them aware of the thing they have to do. So if you do all these things, take all precaution, you can have a zero endophthalmitis, and you should smile on your patient face, and will save you from the court of law. You will not need the help of the doctor.
Thank you so much, sir. It was an in-depth analysis of how we should keep our operation theatres and how we can save ourselves. Dr. Saurabh, sir, any comments?
I think very valid points and all of those, and it's a very nice overview, and also giving the details of all the things which we have to maintain on a daily basis, on a weekly basis, and so many things which we actually overlook. And like cleaning of water tanks and all, which those are some things which you will do when you are going for NABH inspection, but you must realize that we have to take this on a daily basis, and take it very seriously, because we don't want to land up with a cluster endophthalmitis or anything like that, which can be very bad for our practices. So I think very nicely covered by Dr. Satanshu Mathur, sir.
Thank you. Dr. Ragini, ma'am.
I think it was a perfect presentation. He had to finish it in 10 minutes. So, but every line, if you read and follow it like a Bible, then it comes to a very correct OT. And like what Saurabh Bhaiya was saying, that water cleaning and all is not taken. But I know that, like we investigate cases and all that. So we also maintain water cleaning registers. We also maintain autoclave registers. I have to sign the autoclave book before I go in. So like Dr. Bhatt was saying, that these documentations, which when they are not available, they are the problem, because, I'll tell you, 20 years back, we were doing our first camp at Kolhapur. That was the first time we were preparing the OT. We had not even gone for a camp. So that was a site visit, and there was no water coming, and sir was visiting and it was blocked. So sir said, "Main dekhta hu." So he tried to open it, and somebody was there, and out came out a can, a big mass, a blob of worms. So where the tank was never clean. So had we not done all this before preparing the OT, and it was in a proper hospital. So important points, and it was really good, but every line is important. So he had to finish it in 10 minutes. So as always, Satanshu Bhaiya he rocks.
Thankfully, we have all these presentations archived on YouTube, so you can keep going back and listening to it again and following it protocol-wise.
This is the advantage of the webinars.
Yes. Ma'am and sir, do you just wanted a quick question? Like when we are washing our hands for washing up, any particular kind of water is required, or regular tap flowing water is fine?
So we basically, many places, because where the water is not correct or anything hard or anything, AquaGuard water is used. So we are using AquaGuard water to clean our instruments and all that. And normal water is used, and that is why the tank cleaning, the water checking is very, very important.
Yeah, I agree. I think RO water is what we use, and I think that's what is recommended.
I agree with Saurabh. We are also using this RO water, but you can use AquaGuard water also. Important thing is how much time you're giving for scrubbing. Tomorrow, Rohan,
Yes, that is important.
it will not take more than 2 or 3 minutes time.
So what happens is all that, so I see people with long nails, with everything. I don't believe in all those things. You know, you have to have a surgeon's fingers with short nails, and things have to be followed properly, because we don't have the time to sit and scrub and you have to do 50 surgeries and all. So some basic things, and scrubbing and the correct scrubbing, the correct wearing of gloves and removing gloves in between cases.
Ma'am,
All
so-
that is very important. Not
so
using
you-
a single trolley for many cases, just piling on everything and just taking from there. So small points where problems have occurred.
And I'm changing gloves for every case or every 2-3 cases?
No.
Every case.
Every case.
Every case, it is
Every
absolutely
case.
mandatory. Nothing. See, that nothing should go from one case to the other. Nothing.
Okay.
So gown, see, people say that you should change gown after few cases. I agree. But it should be, because, see, we change gowns after a few cases, right? But you know, you see people, I don't know whether you can see me, they stand like this. See, now the thing is that if you know the process of autoclaving, gowns and linen are autoclaved at a different temperature, because if you autoclave them at the temperature of instruments, the kapda will burn. So whenever you are not changing a gown and you change the gloves, once you wear a gown, you are not supposed to touch the gown anywhere. So you are supposed to keep your hands separate, and that's all it's going to touch. So if you don't touch the gown, then it's okay. And otherwise also you should not touch the gown or the green cloth, because the autoclaving temperature of the linen is very different from that. So that is why using disposable drapes with pouches above the green cloth with no seepage. So all that is extremely important.
I agree with Dr. Ragini. We should change I written also in my talk. I mean, the gown should be changed after every 4 to 5 cases. We can't change it after every
But it should not be touched. You should not be touching your gown. Correct, sir. Very
We should avoid unnecessarily touching the gown.
Very true.
Right. So now, without further ado, I would request Dr. Anshika to please introduce Dr. Ragini for our next talk.